Your friend in Central Illinois, WHOW.
Once again, good morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. My guest on the Zoom today is Steve Tenhouse. He is the CEO of Kirby Medical Center in Monticello. And Steve, we kind of teased it going out of the first break there, talking about the history of Kirby in Monticello. Been in Monticello 85 years this year. That's quite the milestone and really some longevity for Kirby. Where did it get started for Kirby Medical Center in Monticello?
Well, it's a great story, and it's one I love telling. So the Kirby Medical Center, and originally called the John and Mary Kirby Hospital, was started with a gift left by John and Mary Kirby.
Mm-hmm.
John Kirby was an immigrant from Ireland. He was sponsored here in the area, was a farmer, rancher, sheriff. And eventually he and his wife became philanthropists, and they had a want for a hospital here in Piatt County.
Mm-hmm.
And they left the bulk of their estate for that hospital to get started. So when Mary Kirby passed away, their daughter Nell took over. She created the corporation. She was the first chair of the board of the hospital.
Mm-hmm.
And they purchased the old Moore Mansion on State Street and converted it to a hospital. And it's fun looking back at the headlines where it talked about, the new hospital has all the modern amenities that you want, including wood-burning fireplaces in the patient rooms and windows that open and, all things that aren't today's standard, but were back in 1941. And after about 30 years, that building no longer met code. It was torn down, and the building, which is now the Piatt County building on State Street, was the second iteration of the hospital. And we were there from the early 70s until 2011 when we built this hospital and opened.
Wow. Yeah. And here you are today. When you built that facility there on, what is that, Monticello's, is that north side of Monticello?
Yes.
Yeah. When you built that, Steve, was the vision, I guess I'll ask you this way. When you built that facility, did you think you would be doing what you're doing today? Did you think it would look like what it looks like today?
It's a great question, and I think we had visions of what it could be, but you just don't know. And we started small, but this building was designed with growth corridors. And as you can see, as you drive by, we have grown into those corridors over the last 15 years as the need has been there.
Mm-hmm.
So we knew what we wanted to offer, and it was a matter of having the space available and then attracting the specialists to come out and do it and then kind of build that momentum. And we've been able to do that. We have probably added 25,000 plus square feet to this building, which was originally around 72,000 square feet. So we've added a second OR. We've, again, greatly expanded our therapy department.
Yeah.
And our Kirby Medical Group has grown tremendously. We've, added on to it probably 5 times over the last 15 years.
Mm-hmm. You talked about specialists there, Steve. Are those individuals employed by Kirby and at your facility full time, or are you partnering with an outside agency, or maybe Kirby in, say, Champaign, and they're coming to you? How does that work?
It's a mix. So the majority of the specialists that come here have practices elsewhere and are spending maybe a day a week here. All depends. And we have specialists coming from both Decatur and Champaign.
Mm-hmm.
Our orthopods come from Decatur. Our general surgeon, we contract full time to be here. And so he's full time, but we don't employ him.
Mm-hmm.
But he's a Kirby surgeon. He does a fantastic job.
Mm-hmm.
And then we contract with other organizations like for our emergency department doctors or our hospitalists, which is very typical of a hospital our size, just because you don't have the volumes to accommodate a full-time specialist. So those specialists tend to share their time in several different places.
Sure. Very good. I want to go back to the part of the discussion we ended on there in the first segment. You said, you made a great comment. You said, pick up the phone. If you call Kirby Medical Center in Monticello, you're probably talking to a person when you make that phone call. Speak to the amenities, the services of a place like Champaign and elsewhere, Bloomington, those types of places, but also having that hometown, like, when you call, you're going to speak to someone, probably a good chance, maybe you're going to know that person. How about that side of it, Steve?
No, it's a good point. One of the things we're most proud of around here is the culture of the organization is not only the technique that our staff use, but how they do it.
Mhm.
And back to your point of, you may know the person. We always say we're a family taking care of family. Because in a small town, in a community this size, you never know if you'll be taking care of a family member or a friend. So for us, that's just an added level of importance to what we do, and to bring that personal touch to it. We have won multiple national awards for employee engagement. And again, culture of the organization is something I'm most proud of. And I think our patients see that every day because we have also won multiple national awards for our patient satisfaction. So whenever you can pull that quality, patient satisfaction, and employee engagement all together, you've got something pretty special.
Word. Yep. Very good. Very good. Along the lines of that kind of family feel, do you encourage your employees to live in Monticello or Piatt County, and be there, as a part of the community?
Sure, we would love them to. Honestly, we've grown so much when we have over 500 employees now.
Oh, wow. Holy cow. I didn't realize that.
So
Wow.
so we pull,
Sure you
we have
pull
a
from
lot of
everywhere.
employees that live in Champaign,
Oh, yeah.
Decatur, and in, Monticello, Muhammad,
Sure. Sure.
all over.
Yeah. I didn't realize you had over 500 employees at that
Mhm.
place. That is incredible.
Yeah.
That is incredible growth. Holy cow.
Yeah, I think it was 125 when I got here 25 years ago.
Wow.
So
Wow.
it has grown pretty tremendously.
Man, I tell you, that's something. That's something. Very nice. Very nice. Well, Steve, I'll tell you what, I'm coming up on having to let you go for the morning, but I do have a few minutes before that. Again, did I miss anything in the conversation today you want to put out there, promote about Kirby? Things going on. Anything we missed? You want to talk about, Steve?
Nothing more. Love talking about it. Love sharing what's going on with the community.
Well, what's next? I mean, are there services on the horizon, or things on the horizon that you're working on? Obviously, I'm sure there's things you can't talk about, but are there things you can that you're excited about or looking forward to?
Well, as you said, there's always something going on, and I think that's the key, is that we're always trying to look ahead to say, what is it that we aren't providing that we can? What is it that we can expand? And for us, honestly, our big focus is on the growth in primary care and adding to our Kirby Medical Group physicians. It's we're rooted, and our foundation is in primary care and family medicine, and really looking to add to that team here in the near future.
Awesome. Very good. Very good. Yeah, Steve, it's great to have you on the program. I really appreciate you making time for us. I know I said this off the air to you before we got started, but as the person that does Monticello sports here at the Hart Media Group and have formerly the Miller Media Group, I just want to say thank you to Kirby for your sponsorship of the sports coverage that we provide over there. You're a great partner in that. You've been a partner in that for many years, maybe from the beginning. I can't even remember, but we very much appreciate that support you provide us, and it's always a lot of fun. So to you, thank you for that opportunity.
Proud to be a part of it.
Yeah, very good. Very good. Well, Steve, one more time to wrap us up, my friend. How do folks learn about all things Kirby Medical Center? Give us a website, maybe, social medias, phone numbers. How about those things, Steve?
Absolutely. So kirbyhealth.org is our website, and all the contact information is there. But check us out on Facebook at Kirby Medical Center, and Instagram also.
Very good. Well, Steve, good to talk to you, my friend. And hopefully we run into each other at some sporting events in the future.
That'd be great.
Yep, very good. Steve Tenhouse is the CEO of Kirby Medical Center in Monticello, my guest on the Zoom this morning. The morning show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. If you miss any of our discussions, like the ones here this morning with Steve Tenhouse at Kirby Medical Center, just check out the Facebook and YouTube channels for WHOW, and you can find replays of our conversations with folks like Steve there as well. Again, the morning show streams to Facebook and YouTube. Network news comes your way next on the morning show.